Peter, is there any advice from what you've learned and what the scientists are studying at the moment that says if you do this, this may prevent dementia, or at least, delay it?
So we have this come up very frequently in terms of, is there can I exercise a particular way or do a particular mental activity? I think the simple answer is there's not a magic certain thing, but doing physical activities and doing mental activities appear to be beneficial. They're beneficial because they're actually engaging your brain, whether you're doing crosswords, playing bridge, or...
What about the tango? They tell me the tango is using the other side of the brain.
I think the tango probably would sort of fit into that category. There's both a physical element. Remember, the second largest cause of dementing illnesses is a vascular form of dementia. So that relies upon or is caused by poor vasculature, like in a sense coronary type illness. So good physical health is a way of trying to prevent that. Good intellectual health is another way. There is one study we were talking about earlier that has provided some reasonable evidence in support of the input or benefit of cognitive function.
So we're talking crosswords, we're talking...
Sudoku,
okay.
but we're also talking about socialisation, about actually using your brain in stimulating ways. It could be as much as talking about what was in the newspaper today or on the headline or in a magazine. It's about actually using and engaging your brain.
Lose it, don't...
Use it
or
don't
lose it. Yes, indeed. Clement, what do you advise people who are in the early stages of dementia and how to cope?
Yes. As Peter mentioned, some of the vascular risk factors, if you could control them, that would improve your outlook over the long term. So if you do smoke, then stop smoking. If you've got high blood pressure, have that controlled. You've got high cholesterol, then it's something that's worth treating. There is some evidence to suggest that a structured exercise program may improve the outcome a little bit. Not as much as one of the medications that would routinely use, but there'll be modest effect for that.
And just keep yourself engaged as much as you possibly can.
Absolutely.
What advice do you give to the families?
Yes, so I think first and foremost there needs to be an understanding that this is a chronic illness. Unfortunately, it's progressive. It's not.
Does it progress very quickly in most cases?
In most cases, it would progress slowly over 9 to 10 years.
Okay.
That would be the median time period. It's not something it's great to have, but on the other hand, it's not something to be feared. I mean, it's something that you need to work around and try to maximize someone's quality of life over that period.
Obviously, this is a very difficult question, but those who have dementia, do we know anything at all about their state of mind? Are they blissfully happy? Are they, constantly worried? We saw a case, when was it, about 5 or 6 months ago, where somebody was able to communicate with somebody who had been in a coma for years, and they indicated through various recorded signs that they were having feelings and the like. I mean, do we have any idea a state of mind of somebody who has dementia?
Yes, we do get glimpses of that. There's certain dementia where people fluctuate in their ability to communicate, say, and with adequate management of mood and also environment, it certainly is possible to improve someone's quality of life.
Somebody said to me that music seemed to work very well with dementia patients. They seem to, familiar music seem to lighten them and make them feel happy.
I think that's a good point there. There's a small but significant literature saying that some sort of reminiscence therapy or things that remind people of the past might help with their behaviour over time.
Tony, that was featured just in the newspaper today with one facility maybe going a long way towards reminiscence. Toasters with the sides that opened. Clement's a little younger than I am.
I don't remember that.
And Clement said he didn't remember what they were.
Do you?
Yes, obviously. I do recall. Professor Peter Schofield's with us tonight, Executive Director and Chief Executive Officer of the Prince of Wales Medical Research Institute. Dr. Clement Loy also with us tonight, a neurologist at Westmead and a senior lecturer at the University of Sydney. Just wondering whether you've got some questions. Perhaps you are going through the motions at the moment of caring for someone who has dementia. Perhaps you have concerns because of areas of your family that may have been impacted by it. Perhaps there's some questions about the areas of research or developments in the whole area of the way we treat dementia. Would you like to join us? We'd love you to. In studio, Professor Peter Schofield and also Dr. Clement Loy, and we're taking your calls on the issue. Maxine, you've got a question about diet.
Yes, I was just wondering how much, yes, there's the obvious genetic and alcohol or accident that can create, increase your propensity to dementia. But would the increase of high fat, salts and sugars, would that our modern diet is laced with salts and sugars and additives and things. And I was just wondering whether this can have a possible effect on dementia or increase the propensity to dementia.
Mm-hmm. Yes, as we were chatting about before, apart from Alzheimer's disease, the other common cause of dementia is vascular problems, that is clogging up of the blood vessels, and high fat and high blood pressure certainly contribute to that. In terms of specific diets, we know that if someone's very deficient in certain nutrients such as folate or B12, they can become demented. However, there's no good evidence to suggest that if you have a balanced diet and you take extra of those nutrients, it would make any difference.
Yeah, so it won't make any difference if you have add to the thing, except if you're B12 deficient.
Yeah,
and make up with a supplement perhaps.